Hi all. Today we will be discussing about what are the vertebral articulations, what are the supporting ligaments, and what is the function of this vertebral column, or what are the kinetics and kinematics of this vertebral column. So first we will be looking into what are the vertebral articulations. So when we look into the vertebral articulations, there are two types of articulations which are found in the vertebral column. So first one is cartilaginous joints of the symphysis type. So it is something much more like an unmovable or with a limited amount of movements. So that is the first type of joints. So these are mainly seen in between the vertebral bodies, including the interposed disc. So these cartilaginous joints of the symphysis type are mainly seen in between the vertebral bodies and also included with the interposed disc. So the second types are the diarthroidal or the synovial joints. So this is much more like a free movable joints which are mainly seen in between the zygophysial facet located on the superior articular, articular process of one vertebra and the zygophysial facet on the inferior articular process of the adjacent vertebra above. So this is mainly between the facets of two vertebrae. So we have superior facet and inferior facet in one vertebra. So the inferior facet of the down vertebrae and the superior facet of the up vertebrae are together forming the zygophysial joint. So then what are the joints which we are commonly seen in vertebrae are interbody joints, that is commonly comes under this cartilaginous or the symphysis type joint. Second one is zygophysial joint between this facets of vertebrae. Then we have joints between the ribs and the spine, between the skull and the spine, and between pelvis and the spine by the means of sacroiliac joints. So these are the main joints which we can see or which we can found in the vertebra. So these are the articulations which are happening in vertebra. So now we need to look into detail about all these joints. So this is a diagram which demonstrate about the interbody and the zygophysial joints. So this is the interbody joints. So basically what you can see, there are two bodies of vertebra, the adjacent two vertebra, and their bodies are interconnected by the means of interbody joints. So this is much more like a symphysis or a cartilaginous joints with a limited amount of mobility. So there is an intervertebral disc also. So this intervertebral disc also plays a role in this cartilaginous joint. So second one is zygophysial joint. So what is a zygophysial joint? It's a joint forming between the superior facet of down vertebrae and the inferior facet of the vertebra which is placed up. So these two will form a zygophysial joint. So these are the two facets. One is superior and the inferior facet. So superior facet of downward vertebrae and the inferior facet of upward vertebrae. So these two will form a zygophysial joint. So this is the general thing. This is the general landmarks. So this is the vertebral body. So we have the intervertebral disc which got the nuchal pulposus, annulus fibrosus, and these are the epiphyseal ends, and we got vertebral arch or neural arch, and this is the intervertebral foramen. So these are the interbody and zygophysial joint which we can found in the vertebrae. So what are the main movements which is happening in the interbody joints? So as we said earlier, these interbody joints are much more like a cartilaginous or a symphysis joint. So there is only some kind of gliding or the sliding movements are mainly possible in this cartilaginous joints. So what are the main movements which are happening in the interbody joints? So first one is gliding, second one is distraction, third one is compression and rotation. So these are the main movements which are happening in the interbody joints. So first one, gliding. So there can be anterior to posterior glide, medial to lateral glide, and there can be a rotational glide. So anterior to posterior, either one vertebral body can come anterior or to posterior. Second one is the body can move medial to lateral, and second the body can rotate in respective to other vertebrae. So next one is distraction. So this is the medial to lateral glide. So this is a distraction. So we are pulling apart. So we are pulling these two vertebral body apart, so that can allow some kind of movement in this intervertebral joint. So this is the distraction. Next, we can go for compression, either on one side or to both the sides. So we can go for compressive forces can be there, and there are some amount of rotations that are possible. So these motions together with the distraction and compression constitute 6 degrees of freedom. So almost all the directions in all the planes, the intervertebral body can go for gliding or rotations. The amount of each of these motions are small and varying by region according to structural differences in the disc and the vertebral bodies, as well as in the ligamentous supports. So it's a, now what we have said is a common about all the vertebrae, but it can differ from the region to region. So the motions which are available in the cervical region are not as much as the thoracic region. So when it comes to the thoracic region, there is a limited amount of motions, or there is a limited amount of movements are possible, mainly because of the surrounding structures of the rib, by the rib cage or the muscles or the ligaments. So all these movements are respective to its region. So if it is in the cervical region is much more free to move in and around when we compare it with the thoracic and the lumbar region. So all these movements are respective to the regions also. So next one is psychophyseal articulation. So what is the psychophyseal articulation? So the psychophyseal articulations are formed between the right and left superior articulating facet of a vertebra and the right and left inferior facet of the adjacent cranial vertebra. So basically what it means. So this is the psychophyseal joint. So we have right and left facet. So in a vertebra we got superior facet and inferior facet. We have right and left superior facet and right and left inferior facet. So how these psychophyseal joints are forming? So first we have two surfaces, proximal and distal surfaces in the psychophyseal joint. So the proximal surface is formed by the inferior facet of one vertebrae, and the distal surface is formed by the superior facet of the adjacent vertebrae, which is down to that. So these are the two vertebrae. So this is the superior one and this is the inferior vertebrae. So this is the superior vertebrae and this is the inferior vertebrae. So how these psychophyseal joints are formed? So there will be an inferior facet of superior vertebrae and a superior facet of inferior vertebrae. So these two things will form the psychophyseal articulation. So this is a diarthrodial joints and have regional variations in the structure. So diarthrodial means there are movement possible, but this is also responsible for the regional changes. So as we said, cervical region has much more mobility of the psychophyseal joint when we compare with thoracic or the lumbar region. So these diarthrodial joints also also in response with the regional changes. So there, in the psychophyseal joint, there can be some kind of intra-articular accessory structures, either by adipose tissues or by fibroadipose meniscoids. So there can be some kind of accessory structures either to increase the mobility or either to limit the mobility or to support the joint structures. These accessory structures appear to be several types, but most classified either as adipose tissues or fibroadipose meniscoids. The structures are most likely involved in protecting the articular surface that are exposed during flexion, extension, and extension of the vertebral column. So whenever we attempt for flexion or extension, the psychophyseal joints can go for much more of stress. So this stress can be limited, or the articulating surface of the psychophyseal joint can be protected by these accessory structures, either by any fat pads or these fibroadipose meniscoids. So these are the two main articulations which are seen in the vertebral column. So first one is interbody joints. Second one is psychophyseal joints. So interbody joints are much more like a rigid structure with a limited amounts of gliding and rotations. When it comes to psychophyseal joint, it's much more like a diarthroidal joints with a high amount of mobility. So next we are going for the ligaments and joint capsules. So what are the ligaments which is supporting the spinal column, and what are the joint capsules which is surrounding the psychophyseal and the interbody joints. So when we look into the ligamentous system, the vertebral column is extensive and exhibit considerable regional variance. So as we said previously, so all these structures are considerable to the changes in the region. So these are the 6 ligaments which can be found in the vertebral column, but it can change according to the region. So when we look into the cervical region, there can be some additional ligaments to this, or there can be some changes with these ligaments. So when we look into the lumbar region, there are some additional regional ligaments to support the lumbar spine apart from these 6 ligaments. So these are the main 6 ligaments which can be found in the vertebral column. So there is an anterior longitudinal ligament and a posterior longitudinal ligament. This PLL represent this posterior longitudinal ligament. Then we have ligamentum flavum, then interspinous ligament, supraspinous ligament, and intertransverse ligaments. So these are the main 6 ligaments which can be found in the vertebral column. So these are the main 6 ligaments which can be found in the vertebral column. So first one is anterior longitudinal ligament. So as the name suggests, it is anterior to the vertebral body. So anterior longitudinal ligament. So it starts from the cervical region and it ends in the sacrum. So it's an anterior longitudinal ligament. Posterior to the body of vertebra, we have the posterior longitudinal ligament. Then the supraspinous ligament. So supraspinous ligament is passing above to the spinous process. So this is the spinous process. Above to that we have the supraspinous ligament. Then we have the ligamentum flavum. So ligamentum flavum is mainly to connect between the lamina of two vertebral bodies. So we have interspinous ligament. So interspinous ligament is mainly in between the spinous process of the vertebrae, and we have intertransverse ligament between two transverse process of adjacent vertebrae. So these are the main 6 ligaments which are seen in the vertebral column. So first one is anterior longitudinal ligament in the anterior middle part of the vertebral body. Then we have the posterior longitudinal ligament in the posterior part of vertebral body. We have supraspinous ligament in the superior part or the posterior part of spinous process. Then we have ligamentum flavum in between the laminae of the vertebrae. Then we have intraspinous ligament between the spinous process of vertebrae. Then we have the intertransverse ligament between the transverse process. So this is what actually happens during flexion and extension to the ligament. So when the spine goes for flexion, this anterior longitudinal ligament can go for compression. So there is not much more tension, but when we go for extension, this anterior longitudinal ligament can go for stretching with the extensive tension in the ligaments. So anterior and posterior longitudinal ligament. Anterior longitudinal ligament runs along the anterior and lateral surface of the vertebral bodies. It starts from the sacrum to the second vertebrae. Extension of ligament from the C2 to the occiput are called the anterior atlanto-occipital and anterior atlanto-axial ligament. So actually this ligament is extended from the sacrum to the C2 spinal level. From the C2 spinal level, the extension of this ligament is called as atlanto-occipital and anterior atlanto-axial ligaments. And this anterior longitudinal ligament got two layers, superficial and deep layer. Superficial layer are long and bridge several vertebrae, and the deep fibers are short and run between single pair of vertebrae. It blends with the fibers of annular fibers and reinforces the anterolateral portion of the intervertebral disc and the anterior interbody joints. So when we look into this picture, we can see there are two layers. One is superficial and deep layer. So what the superficial layer runs along the vertebrae to connect between the vertebrae, and the deep fiber or deep layer mainly to connect between the vertebrae and to reinforce the anterior surface of the vertebra, anterior surface of disc or anterior surface of annulus fibrous. So that is about anterior longitudinal ligament. Next one is posterior longitudinal ligament. The posterior longitudinal ligament runs on the posterior aspect of the vertebral bodies from C2 to the sacrum and forms a ventral surface of vertebral canal. It also consists of two layers. In the superficial layer, the fibers span several levels. In the deep layer, the fibers extends only to adjacent vertebrae, interlacing with the outer surface of annulus fibrous and attaching to the margins of the vertebral end plates in a manner that varies from segment to segment. So this is the posterior longitudinal ligament. So this also got two layers, anterior and posterior layers, not anterior and posterior, superficial and deep layers. The superficial layer runs along with the vertebral bodies. So it is mainly to connect the vertebral bodies, and the deep layer are mainly to support this annulus fibrosis and the disc in position. So this also will give you a structural form to the neural canal. Next one is ligamentum flavum. The ligamentum flavum is thick elastic ligament that connect lamina to lamina from C2 to sacrum and forms a smooth posterior surface of the vertebral canal. So this is the vertebral canal through which the neural components are passing. So the anterior surface of vertebral canal is supported by the posterior longitudinal ligament, and the posterior part of this vertebral canal is mainly supported by the ligamentum flavum. So ligamentum flavum is basically connect between the lamina of two vertebral bodies. Some fibers extend laterally to cover the articular capsule of the sacrificial joint. So there can be some mainly there are some posterior fibers that can extend to support this sacrificial joint articular capsules. So that is a ligamentum flavum. Next we have interspinous ligament. It connects the spinous process of adjacent vertebrae. It describes as a fibrous sheet consisting of type 1 collagen, proteoglycans and profuse elastin fibers. So as it names it, it's a interspinous. So in between the spinal process of two vertebrae, we have this interspinous ligament. Next one is supraspinous ligament. So supraspinous, it's as it names it, it's a supraspinal ligament in the superior part of spinous process. So it is a strong cord-like structure that connect the tips of spinous process from the 7 cervical vertebra to the L3 or L4 vertebrae. So it's actually runs to the tips of spinous process from the 7 cervical vertebrae to the lumbar 3 or lumbar 4th vertebrae. The fibers from the ligamentum become indistinct in the lumbar area, where they merge with the thoracolumbar fascia and inserts into the lumbar muscle. So after this L2, L3 region, the ligament continues as a thoracolumbar fascia and it got inserted in the lumbar region muscles. So that's how the supraspinous, spinous ligament ends in the lumbar region. But in the cervical region, as we said, it starts from the C7. So before the C7 spinous process, the supraspinous ligament known as ligamentum nuchae till the occipit. So the ligamentum nuchae starts from the C7 and it ends in the occipit, or it starts from the occipit and it ends in the C7. From the C7, this ligamentum nuchae continues as a supraspinous ligament till L2, L3 to L4 cervical, L4 lumbar vertebrae. From L4 lumbar vertebrae, it continues as a thoracolumbar fascia and it ends in some lumbar muscles. So this ligamentum nuchae is a structure which is mainly gives some origins to the muscles in the cervical region and it also gives some support to the cervical region. So next we have intertransverse ligament. So as the name suggests, it's a ligament in between the transverse process. So the ligament passes between the transverse process and attached to the deep muscles of the back. So that is an intertransverse ligament. Next one is zygaphyseal joint capsule. Joint capsules assist the ligaments in providing limitation to motions and stability for the vertebral column. The role of joint capsule also vary by region. So as a normal joint capsule, zygaphyseal joint capsule's function is also to limit the motion and also give stability to the vertebral column. So as I said earlier, all this structure can go for regional variations. So according to the region, either it can increase the mobility or it can limit the mobility. So all these structures play a role by its region. In cervical spine, the fascia joint capsules also, although lax, provide a primary soft tissue restraint to the axial rotations and lateral bending. But they provide a little restraint to flexion and extension. So as we look into the cervical region got much more flexibility in the flexion and extension with a limited restraint to the lateral rotations and the lateral flexion. So all these functions are either limited or facilitated by the zygaphyseal joint capsules. The zygaphyseal joint capsules of the lumbar spine, in addition to the annular fibers, also provide primary restraint to the axial rotation. However, those of the thoracic spine do not provide primary restraint to axial rotation. So when we look into the thoracic region, the zygaphyseal joint capsules are limited for its rotation. So in thoracic region, the rotations of spine are much more difficult when we compare with the lumbar region or the cervical region. So when it comes to the lumbar region, there are some amount of rotations are possible, but there also the rotations are limited by the zygaphyseal joint. But when it comes to the cervical region, there are much more rotations are available when we compare with the lumbar and the thoracic region, but the rotations are limited by the zygaphyseal joint capsule. So next one is the function of this cervical column. So whenever we talk about the function, we have to talk in terms of kinematics and kinetics. So what are the kinematics, or what are the movements which is happening in the spinal column? So the main motions are available are flexion, extension, lateral flexion and rotation. So the spine either can go for flexion or extension, or it can go for lateral flexion. There are some rotations. So these are the movements which are possible in the spinal region. And there's also one more term called as a coupling. So whenever we look into this lateral flexion of spine, it is not purely as a lateral flexion. So whenever we attempt for lateral flexion, there are some associated movements which are happening in the spinal column. So that is called a coupling movement. So the coupling is defined as the consistent association of one motion about an axis with another motion in a different axis. So the best example is whenever we attempt for lateral flexion. So lateral flexion happening in one axis. So the lateral flexion is accompanied by a rotatory force or rotation in the vertebral column in another axis. So the coupling is always an associated movement which is happening along with a movement in the spinal column. So the flexion. So whenever we try for flexion, there will be anterior tilting and gliding of superior vertebrae occur and cause widening of the intervertebral foramen and separation of spinous process. And in extension, the posterior tilting and gliding of the superior vertebrae occurs and causes narrowing of the vertebral foramen and the spinous process move closer together. So this is actually what happens during flexion and extension. So during flexion, there is a anterior tilting and an anterior tilting and an anterior glide. So what happens during flexion? This is the two spinous process. So these two spinous process apart from each other. So this is the vertebral foramen. So this vertebral foramen can go for widening. So this is the what happened during flexion. There will be anterior gliding and anterior tilting of superior vertebra, and there will be increase in space between the spinous process, and there is also increased space in the vertebral foramen. So what happens during extension? The opposite thing of flexion. So there will be posterior tilting and posterior gliding. So the spinous process will come together and the vertebral foramen come together, or the space between the space in the vertebral foramen goes narrowing. So there will be a narrowing of vertebral foramen and this spinous process come together. And lateral rotation. The superior vertebra laterally tilts and rotates and translate over the adjacent vertebra below. The annulus fibrous is compressed on the concavity of the curve and stretched in the convexity curve. So this is what happens during lateral flexion. So as we said, there is a coupling happening during the lateral flexion. So it's not only going for lateral flexion, but it also give you some kind of rotations and translations of the adjacent vertebrae below. So annulus fibrosis, the disc or the annulus fibrosis of the intervertebral disc can go for compression in the concavity curve and can go for stretching in the convexity side of the curve. So those are the main movements which is happening in the spinal column. Next, what are the kinetics, or what are the forces which is acting on this spinal cord? So first one is axial compression. So axial compression is a force acting to the long axis of the spine at the right angles to the disc. So axial compression is something like a long axial forces which is coming along with the spinal column or the vertebral column. As a result of force of gravity, ground reaction forces, and the forces produced by the ligaments and muscular contraction. So the spinal column is surrounded by the ligaments and the muscles, and also the gravity can cause this compressive forces to the spinal column. The disc and the vertebral bodies resist most of the compressive forces, but the neural arch and the cycrophacial joints share some of the load in certain postures and during specific motions. So when we talk about the compressive forces, the disc, the intervertebral disc, and the body are primarily designed to resist these compressive forces. So whenever we attend for some motions, or whenever we go for flexion, extension, or a lateral flexion, these compressive forces can change its position from the intervertebral disc or the body to the cycrophacial joints or to the neural arch. So specifically when we go for lateral flexion, the compressive forces can change from the body to the neural arch or to the cycrophacial joint. So during that posture or during the lateral flexion, the cycrophacial can go for maximum compression, basically because this compressive forces changes from the intervertebral disc to the neural arch or to the psychophyseal joint surfaces. So, during bending, some structures can go for compression and some structures can go for tension. So if you are trying for forward bending, the anterior compartment structures can go for compression and the posterior compartment structures can go for tension. In forward flexion, the anterior structures, that means the anterior portion of disc, anterior ligaments and anterior muscles are subjected to compression, and the posterior structures are subjected to tension. The resistance offered to the tensile forces by collagen fibers in the posterior outer annulus fibrosus, psychophyseal joint capsule, and the posterior ligament helps to limit extreme motion and hence provide stability in flexion. So, all these posterior structures are mainly to resist this particular movement and to give proper stability during this flexion or the bending of forward bending of the spinal column. Next one is torsion. So it's basically a rotatory forces. These torsional forces are created during axial rotation that occurs as a part of coupled motions that take place in the spine. So whenever we try for some lateral flexion or a rotatory, it's a coupled movement. So there is no particular rotatory movement. So it's always a coupled movement. So whenever you try for lateral flexion, there can be a some amount of rotatory forces. The torsion stiffness in flexion and lateral bending of the upper thoracic region from T1 to T6 are similar, but torsion stiffness increased from T7 or T8 to L3 or L4. So this torsion stiffness means the limitation of torsions in the spinal column are much more predominant in the T7 to L4 vertebral region. Torsional stiffness is provided by the outer layer of both vertebral bodies and the intervertebral disc and by the orientation of the faces joint. So the rotational forces can be limited by the outer layers of vertebral bodies, intervertebral disc and by the orientation of faces joint. Next is shear forces. So shear forces is something like translatory forces. Shear forces act on the midplane of the disc and tend to cause each vertebra to undergo translations. Either it can move anteriorly, posteriorly, or from side to side relation to the inferior vertebra. So that is a shear force. Shear forces basically means a translatory forces which is happening in the spinal column. So this is the summary of what are the vertebral functions happening or what are the forces which is happening in each of the vertebral structures. So in the body will resist the compressive forces and transmit the compressive forces from one end plate to another. So this is the main function of body of vertebra. The pedicles of vertebra mainly to transmit bending forces exerted by the muscles attached to the spinous process and transverse process to the vertebral body. So pedicles are mainly to transmit the compressive forces which is acting on the spinous process and the transverse process to the body of the vertebrae. Next is laminae, mainly to resist and transmit the forces which is acting on spinous process, psychophyseal articulating process to the pedicles. And it also serves as an attachment site for muscles and ligaments. So next is transverse process. Serve as an attachment site for muscles and ligaments. Spinous process resist the compression and transmit the forces to the laminae. Serves as an attachment site for ligaments and muscles. Next is psychophyseal joint. It resists the shear, compression, tensile and the rotatory forces and it transfers forces to the laminae. Nucleus pulposus resist the compressive forces to the vertebral end plane and translate the vertical compression forces into circumferential tensile forces in the annulus fibrous. Next is annulus fibrous. It resists the tensile forces, torsional forces, and the shear forces. So these are the main structures and its function in the vertebral column.